Hi, my name is Jake Brooks. I work for SSM Cardinal Glennon SportsCare. Every day, hundreds of thousands of athletes participate in a variety of sports. Athletics is a great way for young athletes to learn many different life skills, including health, wellness, cooperation, strategy, and even safety. Every year, about 2.6 million athletes get concussions, and many athletes never know they even had one. Concussions are serious injuries that should not be taken lightly. They can have long-term impacts on children and adolescents, affecting their health, memory, learning ability, and future health. It's crucial that coaches, parents, and athletes are able to recognize the signs of a concussion and the steps that should be taken if a concussion is suspected. Division Director of Pediatric Neurology at SSM Cardinal Glennon Children's Medical Center, Dr. Sean Goretzky, thinks it's important for athletes, parents, and coaches to understand how to treat and care for concussions.
A concussion is really an injury to the brain, usually due to some type of blow or force. The brain starts having dysfunction of the different brain cells. The most common causes of concussion are when your head makes contact to another surface, and that can be the ground, it can be another player, and this can be whether you have a helmet in place or not. Symptoms they complain most commonly of would be things like headache or a pressure sensation in the head. They may complain of nausea. They may have some balance difficulties or complain that they're dizzy. They may complain of their vision being blurry, or they may complain of double vision. They may complain that they're sensitive to light or noise. They may also just say that they feel sluggish, that they feel lazy, a little groggy. They may have difficulty with memory issues. They may be confused. And sometimes they'll just come across and say, I just don't feel right, and they have trouble stating exactly what that is. The signs of concussion, they just appear stunned or dazed, or they may be confused about their assignments or the positions they're supposed to be taking on the field, and they may lose consciousness. They may be moody, they may be irritable, and they may just simply not be able to recall events that happened before or since the concussive head injury itself. So it's important to stop playing or practicing if a concussion is suspected, because we know that most concussions will get better on their own. There have been rare reports of returning to play with a concussion. We know brain cells aren't healthy, there's another hit, and rather than just prolonging concussion, there can be a devastating outcome. There have even been cases that have been fatal where folks have died from having another head injury while still suffering the effects of the first, and we call that second impact syndrome.
Haley is a gymnast who fell off a balance beam and might have a concussion.
Haley, you okay? What happened?
I slipped off the beam and I think I hit my head.
Haley, if you hit your head, we have to make sure you don't have a concussion.
But I didn't get knocked out.
Well, you could still have a concussion even though you didn't get knocked out. I'm gonna go call your mom. I want you to stay right here, and I'll be back as soon as I talk to your mom.
There are some on-the-field tests that can be administered to see if someone possibly has a concussion and if they should go to the emergency room.
Haley, stand with your feet together and fold your arms across your chest. Now, close your eyes and keep your head forward.
I'm feeling really sick and my head's starting to hurt.
All right, we better not take any chances. Let's have your mom take you to the ER. Let's go get her.
Coach Bezelman did the right thing by evaluating Haley and then sending her to the emergency room. The signs and symptoms that Haley was displaying are something a coach or parent shouldn't take lightly.
When a child arrives with any type of brain injury in the emergency department, the most important part of our evaluation is a comprehensive history and physical exam. When children have concussions, we understand the brain is probably not working at its maximal capacity. However, a CAT scan is unlikely to show any abnormalities. Most of the patients that we do evaluations with a CAT scan, we're trying to make sure the patient doesn't have anything more than a concussion, such as a fracture of the skull or bleeding in or around the brain. If the patient is not showing signs of improvement in 2 to 3 weeks, they should probably need to be referred to our neurology clinic.
Typically, the treatment for a concussion is rest and time. A child should sleep when they're diagnosed with concussion. Now, the trick here is to make sure that we think that they're safe. We like to get some sign from the patient that they're not getting worse in any way, shape, or form. As long as they're not, then rest is actually important and crucial to the recovery phase. Missing school for a period of days to a week may be required to help in this rest and recovery phase. And certainly if we're not going to recommend going to school, we'd rather you not do a lot of stimulating things like be around bright lights or noise that are associated with video games, computers, other things like that.
There are 5 graduating steps that a healthcare professional should follow to help the athlete return safely to play. When he or she is symptom-free, you should only go through the steps when you and your healthcare team decide you're ready based on how bad your concussion was and how you're feeling now. If at any time the concussive symptoms return, you should stop these steps and contact your healthcare team. Step 1. Begin with light aerobic exercise to get your heart rate up. You should only do this for 5 to 10 minutes by walking, light jogging, or using a light cardio machine. You shouldn't do any weightlifting, jumping, or sprinting at this point. Step 2. Continue with light aerobic exercise from Step 1 and add activities with limited head movement to further up your heart rate. These exercises may include light jogging, brief running, and low to moderate weightlifting. Step 3. Increase the intensity of exercise to heavy, non-contact physical activity. This can include sprinting, normal weightlifting, and high-intensity cardiovascular exercise. This can also include sport-specific drills in all planes of movement with no contact. Step 4. Reintegrate into practice sessions, including full contact drills in a controlled practice appropriate for your sport. Step 5. Return to normal practice and play. So if you have taken a hit and are experiencing any of the concussive symptoms we talked about, tell your parents or coaches. Taking these precautions will help keep you safe, healthy, and able to play and practice longer. Coaches and parents, you make the difference. Pay attention to the athletes who trust you with their safety. Know the signs and symptoms of a concussion and when to seek medical help. Concussions are serious injuries, and this information can help you protect our young athletes from this all too common injury.